We're talking about the ability to move the tongue purposely, independently, with intention to the sides, inside the mouth. And you certainly could apply that to outside the mouth as well, because we all need that when we're messy, right? Little kids do that all the time. Okay, well, when babies are born, they have a reflex that's called the lateralization tongue reflex. And what happens is if the baby gets any sort of stimulation down the side of their tongue, the tongue will actually move toward that stimulation. But that reflex begins to integrate slowly, and it eventually is integrated into our bodies by the age of 2 years. We begin to see it go away shortly after the babies, not 100% go away, but begin to integrate, slowly begin to go away. Shortly after the baby starts to eat solid foods. But why doesn't it go away right away? Like once you start biting into a biter cookie, why wouldn't it just integrate then, like a lot of our reflexes do? Because we all need to learn to eat a variety of foods between 6 months to a little over 2 years, right? And even a little bit up to 3 years as well. So we need to learn from that reflex how to actually move our tongue. So to answer your question, if your baby's under the age of 2, it's possible that you're still going to see that lateral tongue reflex. And you can take a toothbrush or a textured chew, anything like that, that'll provide a little bit of input, and just put it in your baby's mouth and stroke down the side of the mouth. You should see the tongue move, and make sure you respond. Oh my goodness, your tongue moved. Give them some social reinforcement for that. It might be reflexive at first, but they're learning from the reflex how to do it on their own. And then one other tip, but please check with your OT and speech therapist if this is right for your baby, because I haven't seen your little one, is to go in, and if they don't have all their teeth yet, use a finger cot like this. You get these at Target, the dollar store. I mean, they're everywhere. They're right by the toothbrushes. And just do a little massage right here on their gums, forward, back, forward, back. That will also get the tongue to move toward the stimulation. For those of you who are listening who have older children, one of the things I love to do for kids who are 3 years and up, if they're safe to do so, make sure you check with your therapist, is teach them how to chew gum. It's one of the best ways I've found to work on lateralization, because the gum is sticky enough to kind of hang out on those molars, yet the tongue has to keep working a little bit to keep it over there or to move it from one side of the mouth to the other. So if you're not sure on how to teach a 3-year-old how to chew gum, I have a whole YouTube video on that for you, and I'll post it in the comments for you as well.